Thank you, John, and thank you for having this event. It's very important to get the word out. I'm Mary Ablin. I'm the director of the Area Agencies on Aging Association, and I'm really pleased to be here to share this announcement of the rebate for the drug donut hole. I have to tell you, my mother is a person who's going to benefit from this rebate. I don't think she's quite in the donut hole yet, but I've been telling her, Mom, you're going to give a check for $250, and hallelujah, she was always getting into that donut hole around July or August. So this is a great benefit for benefiting my own mother. But of course, many seniors are going to benefit from the rebate check and the donut hole. In future years, the discounts on drugs, some big discounts on the drugs in the donut hole. And I would like to mention another aspect of the health reform, the federal health reform bill, that is going to be so good going forward. And those are changes and reforms in long-term care. We have some excellent provisions in health reform that are going to emphasize the fact that older adults and people with disabilities want to stay living independent with dignity as long as possible, whether that be in their own home, their own apartment, in assisted living, or wherever. And there are very great provisions in this health reform laws that will help to make that possible. One of them is the CLASS Act, which is a social insurance program that we all can participate in. And I'm looking forward to participating in the CLASS Act. Some other provisions are going to emphasize home and community-based care and some of the programs and options that will help to make those more available right now, because they are not as available as they should be. So I think I'm going to stop at that and pass on the mic.
Sounds great. Marjorie Mitchell?
I thought I wasn't going to talk, John. My mother, too, would have benefited from this. She died a year ago, and contrary to how much she spent of her Social Security check, which was all that she had, I figured it out after she died, and she was spending 58% of her Social Security check on health issues. Part of it drugs, part of it, just things that she needed from the drugstore and that sort of thing. So I wish she had been alive today so that I could hand her a check when it came in the mail. But I think this is a wonderful thing for seniors, and we are just delighted to be here to help celebrate it.
Thank you very much. And our last speaker, Garrett Arrow.
I would like to close it out by saying, as the State Director of Organizing for America in Michigan, a special project of the Democratic National Committee, it has been our privilege to advocate on behalf of the President's health insurance reform principles, one of those being giving security and stability to those with insurance. Top of that list was protecting Medicare for our seniors. 3 months after this historic reform was signed into law, we are now starting to see the fruits of our labor. The President on Tuesday did a teletown hall with seniors to explain some of the benefits that are in the health insurance reform, including starting to close this donut hole by giving them the $250 check. That was part of 100 events that administration officials did across the country, including Health and Human Services Secretary Kathleen Sebelius being here in the state of Michigan with Congressman Dingell, continuing to sell this victory for seniors across the state. This is something that the President is committed to continuing to trumpet across the country. And he has also reached out to his Health and Human Services Secretary to ask her to review other ways to cut fraud, waste, and abuse from Medicare, to protect it for the seniors and take it away from private subsidies. Again, this reform will extend the solvency of Medicare up to a decade. That is a victory for seniors. That is a victory for America. That is something that President Obama will continue to sell to the American people. That is something that Organizing for America will continue to sell to the American people. And I think that we've made that case pretty clear today.
Thank you. So with that, we're going to come to a close. Are there any questions from members of the media?
Let's get some one-on-ones on the phone.
Okay. Well, I just want to thank you all for coming today, and we appreciate your support and getting this information out to the Michigan people. Thank you very much, everybody. And thank you to